We're at the Coolidge Public Health Clinic.
We're doing WIC, which is the Women, Infant, and Children, as well as our public health department, which does immunizations, well women, exams, and services.
On an average day, I will call a lot of new moms. Maybe they're still in the hospital and they're still trying to manage how to take care of their newborn, or they have a lot of questions about breastfeeding.
At any point in their pregnancy, they're eligible to be enrolled as a pregnant mother. One of the great things about that is we make sure that their food packages and their benefits reflect their category. So if they're a pregnant mother, they're gonna get loads of nutrition and a little bit more on the fresh fruit and vegetable side.
I'm on my third baby. This is my third baby, and I breastfed both my kids. Both times it was different. My first one was a natural. My second one, I had to exclusively pump, and that would take double the amount of time of feeding, and it was a struggle bus the whole time.
It isn't as natural as they say it is, and I always say, like, my job would be amazing if it was not necessary, right? And that would mean all the babies and mothers would have no difficulty breastfeeding, but that is not the case.
Each family's different, and their approach is going to be different, and what works for one family might not work for another.
Typically, I'll travel around the clinics where our clients need to be seen. So I will sit down with them, mom and baby, usually a stressful moment for them as they're trying to navigate and learn the ins and outs of breastfeeding within that first month.
A lot of moms, it's hard for them to be confident with how they're doing with newborn care. That's a big thing that we run into with any moms, new or experienced, because I've been there. I understand. I know the curveballs and the learning curves of trying to navigate the parenthood, and so we try to give them confidence or assure them, like, you're doing great. It might not feel like that, but you are doing great.
A lot of emotional support is probably like 70%, and then 30% is the technical stuff. And so we try to just be as welcoming and comforting to them, because it's just such a tender time in their life.
It's just being the relatable part is what, is the big barrier, because they could talk to their doctor about it, right? And get all the information, but it's different when you know that person has gone through the same thing, or somewhat the same thing that you have.
USDA WIC Breastfeeding Award of Excellence is granted to programs who have had a functioning breastfeeding peer counselor program for at least 1 year. They're making sure that pregnant and breastfeeding clients are contacted on a regular basis. Sometimes that's weekly, sometimes that's monthly, sometimes it's every day, depending on the client. And so we make sure to track those. We make sure that no family falls through those cracks. We also ensure that our breastfeeding peer counselors receive monthly training. We want to make sure that they're constantly getting fed updated breastfeeding information, because if anything changes, it's the infant category, new information, new tools, new gadgets. Also just ensuring that our peers and our WIC staff in general have everything they need to make sure that that program functions properly. I love it. It's my dream job. It's been my dream job for like 6 years. I've been doing it since my second son was a wee little baby.
It's really important to have this kind of resource for new families, or families in general, just to make parenting a little easier if we can do that.